Thank you very much. My name is Louise Kent and I am an Irish surgical trainee, and this took place in University Hospital Waterford in the southeast of Ireland. Waterford is a tertiary referral centre which manages a catchment area of about 500,000 patients. So who are our patient cohort? So Ireland, as is echoed globally, is in a huge bed crisis due to our ageing population. So between 2000 and 2014, 170% increase in hospitalisation in patients with vertebral compression fractures. There was a 364% increase in patient days in acute care. And by 2046, there is a predicted 150% increase in hospitalisations in all osteoporotic fractures. So we initially wanted to see where were we at in terms of this in University Hospital Waterford. So we decided to perform a retrospective cohort study in 2020 where we followed patients that were all patients who referred to us with stable vertebral compression fractures over a 90-day period. And we were really disappointed with our results. We found that 54% of patients were admitted. There was over 600 bed days with an average length of stay of 10 days. Over 60 OPD appointments were attended by these patients. 10% developed vertebral compression fracture complications, and only 30% of patients were treated for their underlying diagnosis of osteoporosis. So following the retrospective cohort study, we developed a clinical care pathway which was implemented in February 2021 following multiple education meetings with all stakeholders. And data was collected from all patients who were referred to Waterford with vertebral compression fractures. So if we speak about the patient journey, so if the patient was deemed suitable by the on-call orthopaedic team, they were discharged from the referring emergency department with an evidence-based pain protocol devised by our pain specialist, an information leaflet which provided expected outcomes and red flag symptoms, and then finally a phone number for our advanced nurse practitioner if there was any concerns. The MDT was carried out virtually and consisted of a clinical specialist physio, interventional radiologist and orthopaedics. There was a virtual OPD then conducted by a physio specialist at 2 weeks. And from here, if patients were improving with regard to pain and function, they then were offered a second virtual OPD at 6 weeks post the injury. However, if their pain and function scores were disimproving, they were brought back to a face-to-face outpatient appointment within 1 week of that appointment for further imaging. If obviously any patients had red flag symptoms throughout any part of their referral, they were sent for emergent review by the on-call orthopaedic team in the emergency department. And if following MRI, the patients demonstrated any of the RAND criteria, they were then referred to our interventional radiologists for consideration of vertebroplasty. So with regard to our results, there was 70 patients with a mean age of 74 followed up. There was 71% were female, 64% had symptoms that lasted for less than 2 weeks prior to the referral, 70% were single-level fractures, and 70% of patients were referred from ED. With regard to the length of stay, it was dramatically improved with an average of only 1.7 days in comparison to the 10 days previously. 83% were not hospitalised at all, 17% were hospitalised at some point during their stay. 94% completed conservative management successfully and were discharged after 6 weeks. 1% underwent vertebroplasty and 5% had further imaging and OPD appointments. So to where are we today? So we've continued this in our hospital very successfully. We've changed it now to a digital pathway which allows us to capture more information. 409 patients were referred and 319 were suitable for the pathway. Our care is coordinated by an advanced nurse practitioner, and we're hoping to get a second one. And we're hoping to involve our orthogeriatric team, and we think this would be extremely beneficial. We're just trying to get buy-in from them at the moment. So in the future, we hope to emulate the success of the Irish hip fracture database and bring this on a larger scale, hopefully nationally and then in the future internationally. We've dramatically improved the standard of care of our patients with relatively limited resources, and we're very proud of this and we're looking forward to the future. Thank you.
Thank you very much for a very nice presentation. We have time for 1 or 2 questions. So, yeah, you would like to start?
Yeah, so that was really nice talk. So thank you very much. The number of patients undergoing vertebral augmentation were quite small, just one being a patient. Is that because of lack of awareness or access to spinal services, or are you actually surprised?
No, we have relatively good access in that we have our own interventional radiologists within our own department. We're readily accessible, but I think that we managed the patients quite well. They were linked in with our physiotherapists and that from day or week, the minute they were referred to us, and then they began engaging with them at 2 weeks. So I think, I think that because we caught them early and we started treatment early, that is why we didn't have as many patients being referred for vertebroplasty. I think the fact that we had a standardised pain protocol, which was guided by our pain specialists as well, probably improved the outcomes more than we expected.
Thank you.
Okay.
Last chance. Yeah.
Thank you. Oh, sorry. Yeah. Oh, well, I suppose we probably don't have that issue in Ireland. Well, the GPs actually could refer to us as well. So not all of our refers were directly from ED. We would commonly see patients though being referred from their GP to our EDs with back pain. So just based on my regular occurrence on call, we would see patients in that way. Also, we keep our primary care physicians linked in, so they get a referral letter from us with details not only of the advice we've given to the patient, but also the outcomes of our MDT meetings, each meeting, so at the initial 2 weeks, and then whether they go to our face-to-face OPD or whether they're followed up then at the 4-week mark. So we keep them linked in, but they do have the opportunity to refer the patients in themselves as well, definitely, yeah.
Thank you very much.
Great.